Medicare options in open enrollment. I am Jody Delseer with SHEBA of Lane County. SHEBA is Senior Health Insurance Benefits Assistance. We are a free program administered by the state and county organizations that provides Medicare counseling and advocacy to beneficiaries and their support system. We are sponsored by grants and federal funding, which means we have no financial incentive to sell you on any particular plan. Today we will be covering a quick review of Medicare Part A, B, C, and D, and Medigap, just to refresh your Medicare vocabulary, changes coming in 2025, what you can expect during open enrollment, red flag marketing tactics and scams, and how to explore Medicare plan options on your own. Let's get started. What are the different pieces of Medicare? First is Medicare Part A, inpatient hospital insurance. Second is Part B, medical services and supplies. Together, these are known as Original Medicare, and they're what most people start out with when they turn 65. Your red, white, and blue Medicare card represents these two parts of Medicare. From there, you can take one of two paths. On the first path, you're sticking with Original Medicare and adding prescription drug coverage in the form of a Part D plan. You might also add on Medicare supplemental insurance, also known as Medigap. On the second path, you can opt into a Medicare Advantage plan in which a private insurance company will manage all of the benefits of Part A, Part B, and usually Part D. Let's look at each of these parts more closely. Starting with Part A, hospital insurance. This covers inpatient hospital care, skilled nursing facility care, nursing home care, hospice care, home health care. For more details on Part A coverage, you can check Medicare.gov or talk to SHEBA for details. You won't change your Part A as part of open enrollment. Next is Part B, medical insurance. What's covered here includes medical services and supplies needed to diagnose or treat your medical condition, preventive services that prevent illness or detect it at an early stage, and durable medical equipment. Medicare.gov can be a great place to check about covered services and supplies. You won't change your Part B as part of open enrollment. Once you have Part A and Part B, you can take one of two paths forward. If you stick with Original Medicare, you'll use Part A and Part B, and you'll need prescription drug coverage. For most people, that means adding a Part D prescription drug plan. You can also choose to add secondary insurance, such as a Medigap. If you don't already have creditable coverage elsewhere, like an employer health plan or VA, you'll need it through a prescription drug plan. Part D prescription drug plans are run by private insurance companies that follow rules set by Medicare. All plans must cover a wide range of prescription drugs that people with Medicare take. After that, each plan has its own list of covered drugs called a formulary. Formularies are organized into tiers, and each tier has different copays or coinsurances. Tier 1 drugs are typically generics with the lowest copays. Tier 4 drugs are typically brand names with higher copays. You can change your Part D during open enrollment. With Original Medicare, you also have the option to get Medicare supplemental insurance, also known as Medigap. These are offered by private insurance companies. They cover many of the out-of-pocket costs you pay after Part A and Part B have paid their share, including Part A, coinsurance and hospital costs, Part B, 20% coinsurance, and other costs depending on which plan you get. You won't change your Medigap as part of open enrollment. Moving on to the second path you can take, which is Medicare Advantage. This is a Medicare-approved plan from a private company that offers an alternative to Original Medicare for your health and drug coverage. These bundled plans include Part A and Part B, most often include Part D. Plans with no Part D are available for those who have coverage elsewhere, such as VA. Plans may also offer some extra benefits that Original Medicare doesn't, such as hearing, dental, vision, and fitness. You can change your Part C during open enrollment. Let's briefly test your knowledge. Which part of Medicare covers durable medical equipment such as walkers and canes? That's Part B. Which part covers your inpatient hospital stay? That's Part A. Which part covers a blood pressure medication you might pick up at the pharmacy? That's Part D. And Part C, Medicare Advantage plans with drug coverage. Which part includes dental? Part C may have some benefit depending on the plan you choose. Which part covers flu shots? That's Part B. Which part covers skilled nursing facilities? That's Part A. And which part covers fitness membership? That's Part C, may have some benefit depending on plan. Let's move on to some changes coming to Medicare in 2025. The first is a Part D cap on prescription drug costs. In 2024, beneficiaries must pay up to $8,000 before catastrophic coverage kicks in, and you pay nothing more for prescriptions. In 2025, there will be a $2,000 out-of-pocket cap. This is anticipated to lower costs for tens of millions of Medicare beneficiaries. Second, there will be no more coverage gap. Plans may include a drug deductible of up to $590, which you'll pay first. Then you pay co-payments until you reach the $2,000 max. There's no mid-year period where your prescription prices go up dramatically. If you already have Part D, then your plan may be adjusting its premiums and co-pays. It's good to check on what costs you can anticipate next year and shop around to see what else is out there. The third change is the Medicare prescription payment plan. This new opt-in payment option works with your current drug coverage to help you manage your out-of-pocket drug costs by spreading them across the calendar year. This payment option might help you manage your expenses, but it doesn't save you money or lower your drug costs. If you select this payment option, each month you'll continue to pay your plan premium if you have one. Then, instead of paying a copay at the pharmacy, you'll get a bill from your health or drug plan to pay for your prescription drugs. Fourth is possible changes to Medicare Advantage coverage. The $2,000 gap also applies to Medicare Advantage plans with drugs. This might mean the MA plan is paying more for the prescriptions you're using, and to cover the difference, they may change their formulary, max out-of-pockets, dental benefits, and so on. If you have a Medicare Advantage plan, review changes carefully. Again, it's good to shop around to see if there's something even better for you. Fifth is a Part B premium increase. The Part B premium changes from year to year. In 2024, it was $174.70. The amount for 2025 hasn't been released at the time of this recording, so check Medicare.gov for information. Sixth is a Medicare Advantage mid-year statement. Enrollees will receive a mid-year statement detailing which benefits they have and haven't used. This will help people keep track of those bonus dental, vision, hearing, and fitness benefits so you can get the most out of your plan. Next, let's talk about what you can expect during open enrollment. Open enrollment runs annually from October 15th through December 7th. Every year, Medicare health and drug plans can make annual changes to cost, coverage, and in-network pharmacies and providers. During open enrollment, you can review these changes and change your Medicare health and prescription drug coverage, Parts C and D, for the following year. Your plan should send you an annual notice of change each fall to let you know what changes to expect. You might see more ads on TV or get mail from insurance companies that encourage you to change. You can compare plans and pricing for 2025 on Medicare.gov starting on October 1st. As open enrollment is going on, here are a few red flag marketing tactics to watch out for. Unsolicited phone calls with companies that you have no prior relationships with, a company representing itself as being part of or endorsed by Medicare, Medicaid, or Social Security, flyers, leaflets, or door hangers from a company with whom you do not have an appointment, insurance agents discussing other products, such as life insurance, during a visit about a Part C or D product. While you're considering changes to your plans, keep safety and security front of mind. Know that Medicare and SHIBA will never call you unless you call them first. If you get a call that you're not expecting from Medicare, hang up without giving any information and call 1-800-MEDICARE directly to validate what the caller was telling you. Protect your Medicare number like you would protect your credit card information and Social Security card. Unless you're going to the doctor, consider leaving your Medicare card at home. Be on the lookout for some common scams, such as laminating cards. People offering lamination may also be scanning or copying down your Medicare information. Plastic Medicare cards with chips. If you get a call offering you a plastic Medicare card, hang up. There is no such thing as a plastic Medicare card. Free COVID tests. There are websites that promise to send you COVID tests after you enter your Medicare number. Do not enter your Medicare number online except for on Medicare.gov. And aggressive callers. If someone is claiming that you owe money or giving you an urgent short-term offer, be very wary. Don't allow them to make you feel nervous due to a sense of urgency. Consider hanging up and calling a reputable number to verify the claim. Now let's do a demonstration of what it looks like to compare Part C and D plans on Medicare.gov. For this demonstration, we will be helping somebody named Linda. She is 70 years old and lives in Springfield, Oregon. She prefers Fred Meyer Pharmacy, but is open to Walgreens and mail-order pharmacies. She takes amlodipine for high blood pressure, celecoxib for arthritis, and sertraline for depression. She has twice-annual doctor visits and sees a mental health therapist every month. Before we get started, please note that SHIBA does not endorse any particular plan that we will be looking at in these examples. It's just for demonstration only. To start, let's go to Medicare.gov. Then, scroll down and click the green Find Plans Now button. Then be sure 2025 is selected. We'll enter Linda's zip code 97477 and click the green Continue button. Next, let's say that Linda is currently on Original Medicare and has a Part D plan. Later on, we'll show what it looks like to compare Part C plans, but for now, we will select Medicare Drug Plan Part D and click the green Find Plans button. Next, you'll see a screen asking whether you get help with Medicare costs from any programs. If you do get help from one of these programs, selecting the program will help the website to automatically factor it into the costs. For Linda, we will select I do not get help from any of these programs. Then click the green Continue button. Next, it will ask if we want to compare drug costs. We do, so click Yes, and click the green Next button. Here's where we will enter in Linda's prescriptions. We'll start with the amlodipine. Here's a tip. If you enter in a brand name drug, like Norvasc, the website will ask if you would like to enter the generic amlodipine instead. We'll click the Add Generic button. Then we'll enter her dosage, the quantity per refill, and the frequency of refill. The dosage shows up in a drop-down menu. We'll say that her dosage is a 10 milligram tablet, 30 every month. We'll click Add to my drug list. Next, we'll do the same with the celecoxib and sertraline that she takes. When we confirm that this is her drug list, we can then click the green Done Adding Drugs button at the bottom of the page. Now we will enter the pharmacies that she goes to. Linda said that she's open to mail order pharmacy, Fred Meyer Pharmacy, and Walgreens. We'll check those boxes and then click the white Done button on the right side of this blue ribbon here. Now, Medicare.gov will produce a list of Part D plans that are available in Lane County for Linda. It is sorted by lowest drug and premium cost, lowest to highest. We see that the least expensive plan on her list is Cigna Healthcare Assurance RX PDP, with a $0 monthly premium and a total of $232.56 retail pharmacy or $198 mail order pharmacy. We're going to select Add to Compare so we can look at this against other plans. The next option is Humana Basic RX Plan PDP with a $7.90 monthly premium, a $276.60 costs at retail pharmacy, or $366.72 at mail order pharmacy. We'll select Add to Compare for this as well. You can compare up to 3 options at a time, but for this demonstration we'll stick with these 2. We'll click the white Compare button at the bottom right of the screen. Here you can see the 2 plans side by side with information about their star ratings, their total monthly premiums, and their yearly drug deductibles. One good thing for Linda to note if she goes with the Cigna plan is that it looks like Fred Meyer Pharmacy is out of network. So if her prescriptions are already sent to Fred Meyer Pharmacy, she'll need to get them sent to a different pharmacy. But if she's looking at the side by side, it looks like with Cigna, the least expensive option, retail at Walgreens, is going to be less expensive than least expensive at Fred Meyer Pharmacy, mail order even less expensive still. So let's say that Linda is ready to commit and says, yep, this Cigna plan is going to be the least expensive for me overall, and so that's what I'd like to go with. From there, all she needs to do is click on this blue Enroll button. Then Medicare.gov will walk her through an enrollment process. Her existing plan will continue through the end of the year, and the Cigna plan will start on January 1st. As a side note, if Linda is already on this Cigna plan, she won't need to do anything to renew it. Now let's say that Linda wants to look at Medicare Advantage plans instead of Part D plans. The process for looking at them is the same, but there's a lot more to compare and consider for these plans. So let's go back to Medicare.gov, scroll down and click the Find Plans Now button. We'll keep Linda's year and zip code the same as we did when we were looking at Part D plans. But instead of Medicare Drug Plan Part D, we'll be clicking on Medicare Advantage Plan Part C, and then Find Plans. Again, she doesn't get help from any of these programs. Here are her prescriptions, the same as we entered earlier. And here are the same pharmacies that we entered earlier. Now we'll see a bunch of different options. So when we are looking to compare, we'll exit out of the 2 plans that we were comparing from Part D and start fresh. So several of these Medicare Advantage plans on this list have a $0 monthly premium, and all of her drugs are covered in full. So Linda has a lot of options. For this demonstration, we'll click on the first 3 to compare. So AARP Medicare Advantage Essentials from UHCOR-4, Atrio Choice RX, and WellCare Simple Open PPO. Great. Then we'll click on the white Compare button. On this comparison page, there is a lot of information to sift through. It helps to remember Linda's priorities, which are that she sees her primary care physician twice a year and a mental health counselor once a month. So we'll pay special attention to those as we look at this information. But we'll point out a few things to especially pay attention to here. First, is the plan an HMO, HMO POS, or PPO? You can see the AARP is an HMO POS, Atrio is a PPO, and WellCare is a PPO. This affects how many providers are in the provider network. HMOs don't have as many providers in their network, and PPOs have more. Another thing to look at is what is the maximum you pay for health services in a year. This WellCare plan is the lowest. The most that she would be paying in a year is $3,450, whether she's paying in-network or out-of-network providers. Scrolling down, this is an overview of some of the extra plan benefits that Medicare Advantage plan sometimes offers. It looks like the AARP plan doesn't have the extensive dental coverage that the other plans do, so that's good to note. But also, she'll want to look into the specifics of what that dental coverage includes as she digs deeper. So while it says the Atrio and WellCare plans both have these dental options, it doesn't describe in depth what exactly is covered and what her copays or coinsurances might be. Continuing to scroll down, we can see benefits and costs for primary doctor visits. That's one of her priorities. And for those twice annual doctor visits, it looks like she has no copay if a doctor is in network. So she will need to check on whichever plan she is interested in to see whether her existing providers are already in network. We'll keep scrolling down, and again, this is a lot of information, so be sure to take time with it as you compare plans. But as we get to the bottom, we'll see the drug coverage and costs again. And you can see that with any of these plans, Linda has no prescription copays all year with any of the plans at any of her chosen pharmacies. So let's look into those mental health visits, and we'll see what these plans look like up close. Let's say Linda is interested in this WellCare plan. We're going to click on plan details to see if we can find information about that mental health counseling. On this page, you can see a more detailed rundown of costs for just this one plan, the WellCare Simple Open. This has a lot of the same information from the last view, but even more detailed, especially if you scroll down to View More Benefits and Costs, where right here you can see mental health services. For outpatient individual therapy visit, it looks like a $25 copay in and out of network. The next step for Linda would be to go to the plan website and make sure that her providers are in network. To do that, she can scroll to the top of the page and click the green Plan Website button. Every plan website is a little different, so I'm not going to go into detail about what this website looks like. But most of them have search features to look up whether your providers are in network. Then, once Linda is ready to commit to a plan, she can click the green Enroll button and follow the steps on Medicare.gov to get signed up. Her current plan will continue till the end of the year, and the new plan will start on January 1st. Now that Linda has what she needs to move forward, let's talk about next steps for you. First, make a plan for reviewing your plan. Keep an eye out for your annual notice of change, and scope out options and get questions answered over at Medicare.gov. If you need help reviewing your plan, talk to Sheba or a trusted licensed insurance agent. Information about your local Sheba office and Medicare insurance agents near you can be found at sheba.oregon.gov. That concludes this presentation. Thank you for watching.